Hi, I'm Dr. Amy Nguyen. I'm a urogynecologist here in Frisco, Texas. Today we're going to be talking about painful bladder syndrome, also referred to as interstitial cystitis or IC for short. Painful bladder syndrome oftentimes presents with symptoms of what feels like a urinary tract infection, but when they test for it, there's no evidence of any kind of bacteria. That has very similar symptoms in regards to pelvic pain, burning with urination, or urinary urgency, frequency. And when you go to the doctor and they actually take a urine sample and they send it off to the lab, there's no evidence of a bacterial infection. And that is very suspicious for painful bladder syndrome, or what we call IC for short. It's an inflammatory condition of the bladder that's chronic. The exact cause, no one really exactly knows. But the protective inner lining of the bladder is now thought to be defective, such that anything that we eat or drink penetrates directly into that bladder and can cause the symptoms of pelvic pain or the urge to urinate frequently during the day and even at nighttime. This can be very bothersome and distressing to many patients, and it can occur at the spur of a moment. Typically, we see women present anywhere between their 20s to like 60-year-olds. And again, what's frustrating is no one knows the exact cause. And so it's not unusual that when we first see patients, they're in tears because they've got this unrelenting pain that they don't know how to treat. The good news is that it certainly is treatable, and we can treat it with diet. I think diet matters, and so bladder diet is what I refer to as anything you want to be very conscious of what your bladder diet is, because certain things that we eat or drink, believe it or not, can irritate your bladder and can cause more pelvic pain or urgency and frequency, and it's everything that you and I love to eat or drink. So anything acidic or caffeinated or spicy, as it hits that bladder, can cause pain and cause you to have more of an urge to urinate. Also, stress, sometimes it's not even diet that triggers patients to have the pain. It could be stress, and who doesn't have stress in their life right now? So figuring out what your triggers are will help you be able to modify and manage your symptoms better. Also, we can treat symptoms with medications, we can treat it with physical therapy, and then we can treat it with acupuncture or even bladder installations, which in cases where patients flare, we can mix up a special cocktail of medications, and then we insert it and instill it into your bladder, and that can help relieve some of the pain, discomfort, and inflammation. So first thing is always important to be evaluated by either a urogynecologist or a urologist if you're starting to have symptoms of pelvic pain or irritating bladder symptoms. So I hope this video helps. If you like this video, don't forget to subscribe, click that ring button to be notified of future videos.